Today's show, I bet we'll be tuned in because he's a hockey player and hockey fan. He's also the director of primary care for Henry Ford Jackson, Travis Zebel. Hi, Travis.
Hey, Bart. How you doing today?
Good. Nice to see you.
Good to see you as well.
Yeah, you spend a lot of time at the ice arena.
We are at the ice arena frequently. I have 3 sons that all play hockey, and we will be at that game. I referee hockey as well, so I actually am assigned that game, so I will be there.
Wow, you will be running the game.
Yeah, so be kind to your refs.
Yeah, hockey fans can be brutal.
They can.
Yes.
They can.
So you have all your kids following in your skate steps.
I have 3 sons and 1 daughter, so my 3 sons are all hockey players. Yes, absolutely. I couldn't prevent them from going down that path.
Well, many years ago, Jackson College had a hockey team, the Jets, and you were on that team.
I was absolutely. And when I came today, they asked me if I had ever been on the show, and I think that was the last time I was actually here in the studio, was when we were headed to nationals for the Jackson College Golden Jets. So it's been since, I think that was 2004 or 2005.
Wow, and really that was a great period in Jackson College's history. Be able to field a hockey team, and it was Dale Smith, late Dale Smith, who really, it was his idea, and he he funded a lot of it.
Yes, he did. Yep.
And he made it was a dream that he made happen, and the community's better for it.
Yes.
Well, we've got the Townsend Medical Center has been a very popular destination for people seeking their family doctor and family or primary practice, but it had an issue.
We did. On Wednesday, January 18th, we had a pipe burst in our ceiling that ended up triggering our sprinkler system, which led to some extensive flooding there in the clinic. So we had to work quickly to get all of our patients out of the building at the time, as the water was coming down right within the building.
Oh, really? During the day?
Yeah, it was probably 5:30 at night. So we had a couple patients that were there at our same day clinic, and we have a couple providers that generally stay later at night. So it wasn't a full house, but we had probably 10 patients or so in the building at the time that the sprinkler went off.
Anybody injured?
Nobody was injured, no. Our team did a great job of getting everybody outside, and from my understanding, nobody even got wet. They were able to get out before the sprinkler system hit them, so
wow.
That was good. Did
the thing go off in the whole place?
It went off in one sprinkler system in particular on the top floor that ended up, it fell through the walls and into the second floor as well, so both floors were damaged with water.
So the whole place?
The whole place currently is shut down, yes. It went through some of the walls, got into some of the subfloor on the first floor, so remediation efforts are currently underway.
Mm-hmm. Yeah, and that takes really a long time to recover from. I remember Jackson College had some water damage from, it was a tiny fire, but the water was catastrophic.
Yes, yeah. That's what we're looking at too. Most of the patient rooms had some sort of water that was affected into it, so probably 80-ish, 85% of the building had some sort of damage that needed some resolution.
Wow, and we've seen the pictures from hurricane and floods, where they have to rip out everything, because once water gets into drywall, it's no good.
100%. So we had to. The company that's working through it now they removed one of the walls and had to get in and pull out some of the drywall in some of the areas. So yes, it's quite an extensive project.
You've got a lot of expensive equipment, I would imagine there too. Did anything get damaged?
Fortunately, nothing major. We did have some damage to our communications tower, so some of our IT infrastructure that will need to be replaced. But as far as X-ray machines or any of our EKG machines or any of that we have in the building, nothing major seemed to be put out of service.
Well, it's a very popular facility. Anybody that's ever driven by it can tell instantly there. It's a large building with a full parking lot usually. What all goes on at Townsend?
Yeah, so we have family medical, so any of your primary care physicians. We have 12 practitioners that work out of there, a mixture of physicians and advanced practice providers. We have a same-day care clinic on our lower floor where people can be seen for acute issues. And we also have a laboratory and x-ray room where patients can come in and get their labs drawn, get any kind of imaging that they have. And currently all 3 of those services that are in Townsend are out of service.
And have you been able to engage contractors and get things started right away?
Absolutely, absolutely. They were on site the next day, already working on the remediation plan, and they are still there actively working this week.
All right, so what's happening in the meantime? Everybody off on vacation?
Not quite, not quite. We want to make sure that we still have access available to our community and our patients, so we have actually found locations for all of our primary care providers, so they are at different locations than Townsend. Some of them are at our East Michigan location, out in our Brooklyn location, downtown at Internal Medicine. So we've spread them throughout all of our other 10 locations that we have within our primary care setting. Our lab and x-ray techs have been distributed to other locations as well so that they can still, we anticipate an increase in census, and we've seen that since Townsend has gone down. It's one of our busier locations. So they're supporting some of the other ADCs, as we call them, which is our term for labs, lab and x-ray. And then we have the same-day care location that was in the basement. They have actually moved in temporarily at our East Michigan family medicine location.
So really, geographically, not really far to go for an alternate.
Correct. We tried to keep everybody as close as we could to Jackson proper. There were, we had a very creative team using and looking at all of our space and trying to make sure we fit everybody in to accommodate our patients' needs.
We call them labs, and
Yes.
my favorite lab is, I've got 2. It's a tie right now. The one in the Henry Ford building on East Michigan,
Yeah.
and the one on Spring Arbor Road.
Okay.
They're both excellent, and I've been to actually both of them in the last year, so you've got a great team at those places.
Absolutely. So those are our 2 probably the closest in proximity. We also have one out in Brooklyn. We have one in Spring Arbor. We have one actually on site at the main campus in Suite 104 in the professional building. So there are plenty of options for our community to still go and get those lab services.
So how's your team responded to these unexpected changes?
They acted very quickly, and they did a fantastic job of really hunkering down and making sure we found places for everybody to practice. This happened on a Wednesday night, so we got our team together on a Thursday, essentially locked ourselves in a room and made sure we figured out where to distribute all of our providers. And we had a couple people up and running by Friday. And by that following Monday, we had all of our providers open to seeing their patients that they already had scheduled. So we had a team of individuals calling folks to make sure they knew about location changes. So the team really pulled together and did well, and now everybody is up and running.
Yeah, I see. I'm looking at this list of providers. You've got, as you say, a dozen or so spread all throughout, and even into Albion and Brooklyn.
Yes. We, as we said, we tried to maximize the space best we could, and hopefully we are still available and accessible to our patients in our community.
You guys have established a website for people with any questions, or?
We do. That website is henryford.com/Townsend updates.
All right, Director of Primary Health. What does that mean?
Primary health. So primary health is a term that we use in our organization that encompasses primary care, internal medicine, pediatrics, and women's health. So those are the 4 areas we oversee. And then it also, as part of our primary care, is the same-day care locations.
I think this is the busy season, isn't it?
It is one of them. There's not much of a slow season, but this is definitely one of the busy seasons. We're seeing, and we speak of peds, we're seeing a lot of kind of that influenza B coming around right now, and it's hitting people in groups. So yeah, it has been a busier season.
What if someone doesn't have a doctor? How do they go about getting the first experience with a family or primary practitioner?
Absolutely. So we have a site that people can go to at henryford.com where it's Find a Provider link. And those actually come right to us where we can reach out to the patient and get you set up with somebody that makes the most sense for your geographical location. There's a Find a Doctor tab right there on the henryford.com site.
Yeah, so really, if someone were to call a certain provider who might be busy and can't get someone in a few months, that doesn't mean they're all that way.
Correct. So each provider has a certain amount of patients that they can handle safely and appropriately. So once they get close to that limit, we start looking at some of the other providers in our group. So while some of the providers may have fuller panels, we definitely have plenty of physicians within our group that have openings and are able to see new patients.
Oh, good.
Yeah.
So there you go. They are welcoming new patients. And are you a recruiter? Do you go out and look for providers?
Well, I am not officially the recruiter. We have a recruiting team, and we are presented with providers quite frequently. We actually this morning interviewed a provider. So at this time of year, a lot of times folks are getting done with their residency programs, and so they're looking for places for employment once their residency programs are done. So usually the first part of the year, we do see more candidates from a physician standpoint than at any other time during the year.
And we have a program right here where...
We do. Henry Ford has our own GME residency program here in Jackson. So there are a couple of physicians that we have been able to recruit from that particular program. So it's been a great asset for us.
Yeah, and I've learned that when these folks come to Jackson for the residency, they pretty much have in their mind where they want to end up geographically, or in what type of. So it's even harder to change their mind at this point.
Yeah, absolutely. There's a healthy chunk of that residency program that if you were to ask them year one, they probably know where they want to go geographically by the time they're finished.
But as a health system with a really big footprint here in Jackson, must be, and really how Jackson looks now, and you grew up here, it must be an easier sell for Jackson.
It is. I have, I always tell our providers when they're interviewing, if you need to know anything about the city or the community, please let me know. I grew up here. I'm a cheerleader for the Jackson County. Never lived more than 10 miles from downtown. I live in the county of Jackson my entire life, went to school here, so I try to sell not just Henry Ford, but Jackson as a whole.
Nice. Well, and you do a lot in the community as well. As you mentioned, you're reffing the Friday night game.
I am. I found that out last night, so I'm assigned that game, so I will be there with you guys on Friday at 5:30.
Is that a tough assignment?
They all can be tough. It all depends on how the game goes, right? It's sometimes they're smoother than you would anticipate. Other times you'd think it'd be an easier game to referee, and things get a little out of control. It's hockey. It's a sport where it can change on the drop of a dime. So you always have to be ready.
It's like the old joke. Went to the fights the other night, and a hockey game broke out.
That's right. That's right.
Now, is there additional scrutiny on you and the other officials being on live TV?
No, not too much. We've, as you guys have been around for years now, there was a time, this had to be maybe 10 to 15 years ago. I remember doing a game where you guys were there and they had me wear the GoPro as a referee, right? So we were skating around with the GoPro on, and I don't know what came of that, but I remember it was somebody from JTV had us putting a little GoPro on top of our helmet.
Yeah, what probably happened was someone said, you guys aren't going to do that anymore.
Yeah. I don't know if we can show that language, right? Yeah.
Well, what's the timeline for Townsend to be all back and up and running?
So from the point that it happened, which again was on January 18th, they have told us 60 to 90 days. We have daily, not daily, but weekly updates from the team that's working out there. Everything seems to be going on schedule as of now. So we're looking anywhere from March 20th to April 22nd in that time frame. Our goal, hopefully, is to be able to piece together a little bit at a time. Maybe there's an opportunity to open one wing of the upper or lower level at a time and start phasing people back.
Well, awesome job you and your team have done getting this all up and running and scattered throughout the system. Appreciate you coming in with the updates.
Absolutely, absolutely. Thank you so much,
You
Bart.
bet. Good to see you,
All
Travis.
right, you too.
Travis Zebel is Director of Primary Health at Henry Ford Jackson.